Hey, and welcome to The Explainer. Ever stop and think about what actually happens when one of the body's wires, a nerve, goes on the fritz? Today, we're diving deep into the consequences of untreated peripheral nerve disease. And trust me, this isn't just about passing an exam. It's about understanding the incredibly delicate wiring that keeps us all moving. So let's get right to it. What happens when you just ignore a nerve problem? Well, it's not just a little numbness or weakness that you can tough out. No. It kicks off this whole chain reaction of really serious complications. Getting a handle on this chain is absolutely key to understanding why catching these things early is so incredibly important.
Okay, so let's follow the path of destruction, shall we? When a nerve's communication line gets cut, the effects start to cascade just like a line of dominoes. And the very first domino to fall, that's the muscle itself. Right. So when a nerve gets damaged, the muscles it's supposed to be talking to start to get weak and literally shrink away. We call this process atrophy. And look, this is way more than just a muscle getting smaller because you stopped going to the gym. This is a fundamental breakdown right down at the cellular level, all because its lifeline from the nerve has been severed.
You see, here's the really critical part. Nerves don't just send zaps of electricity. They are constantly feeding the muscle, providing this trophic support that keeps it healthy. Once you cut that off, the muscle's protein-building factory just grinds to a halt. And over time, that healthy, powerful muscle tissue gets replaced by this useless gunk, a mix of fat and scar tissue that can't contract at all. And this is where you start to see these really classic, telltale signs of specific nerve injuries. The muscle weakness creates an imbalance around the joint, leading to these signature deformities. You see a radial nerve issue, you get wrist drop, or the person can't lift their wrist. An ulnar nerve problem, you might see a claw hand. A damaged peroneal nerve down in the leg, that leads to foot drop, where the foot just drags with every single step. But it's not just about what you can't do. Sometimes it's about what you can't stop feeling. Nerve damage can unleash one of the absolute hardest things to treat in all of medicine, chronic neuropathic pain. This isn't your normal, ouch, I stubbed my toe pain. This is the nervous system itself going completely haywire. So what's happening here is that the wiring itself gets broken and starts to short circuit. Damaged nerves can just start firing off these random abnormal signals all on their own. And to make it worse, the brain and spinal cord become hypersensitive, basically turning the volume up on these false signals. That's why people describe it as this relentless burning or like getting hit with a sudden electric shock out of nowhere.
Okay, so what about the opposite of pain? What about just not feeling anything at all? It might not sound as dramatic, but let me tell you, losing sensation is a silent and incredibly dangerous threat. It's like deactivating your body's entire alarm system. Just think about it. Without that protective feedback, you could get a nasty burn and not even know it. You could walk around all day with a sharp rock in your shoe, creating a massive wound that you are completely oblivious to. This is how a small, totally preventable injury can spiral into a severe, non-healing ulcer or a deep infection. It's a huge problem, especially in conditions like diabetic neuropathy. And finally, let's not forget the autonomic nerves. These are the ones on autopilot, controlling things like blood flow and sweating. When they get damaged, you can see all sorts of weird stuff happen to the skin and circulation. We're talking cold, swollen hands and feet, skin that gets weirdly glossy and loses its hair, and in the worst cases, it can trigger something truly awful called complex regional pain syndrome, or CRPS, where the pain and swelling are just off the charts. Whew. Okay, so we've seen just how bad the damage can be. But what about the flip side? What about recovery? Once a nerve is hurt, what actually determines its chances of healing? Understanding the prognosis here is everything for setting expectations and planning treatment.
Well, the outlook is definitely not one size fits all. It really depends on a bunch of things. What caused the injury in the first place? How severe was it? How long has the nerve been compressed or inflamed? And yeah, even age plays a big role. Younger people just have a much better capacity for nerve regeneration. And this is a really neat way to think about it. SEDEN's classification basically sorts injuries by how bad they are, which helps predict if they can heal. So think of neuropraxia as a temporary traffic jam on the nerve highway. The road's fine, and a full recovery is expected. Axonotmesis is more serious. The wires inside are broken, but the main cable is still intact. So recovery is possible, but it's going to take time. And then you have neurotmesis. That's a completely severed cable. Without surgery to reconnect it, there's just no way for the signals to get through.
And when I say it's going to take time, I mean it. Even in the best case scenario for regeneration, it is an agonizingly slow process. We're talking 1 to 3 millimeters a day, max. To put that in perspective, for an injury up at your shoulder to regrow all the way down to your fingertips, you could be waiting years, not months. So, given how painfully slow that road to recovery is, you can probably guess what's coming next. Prevention is everything. Honestly, the absolute best way to treat nerve damage is to stop it from ever happening in the first place. So, let's break down how we do that.
It really boils down to this three-tiered approach. Primary prevention is about stopping the problem before it even starts. Think better ergonomics at your desk or getting blood sugar under control. Then there's secondary prevention, which is all about catching it early. And this is where a good physical exam is worth its weight in gold. We have simple tests like the Phalen test for carpal tunnel. You just have the patient flex their wrists, and that pressure increase can trigger their symptoms by causing a little ischemia or reduce blood flow to that already irritated median nerve. Or the Tinel sign, where you tap over the nerve. If it's cranky, that little tap will send a jolt of pins and needles right down its path. And it's not just for the wrist. For thumb pain, we use Finkelstein's test. You tuck the thumb in and bend the wrist away. This stretches the tendons involved into Quervain's Tenosynovitis. And this is so useful because it helps you tell the difference between a tendon problem and a true radial nerve issue, which would present differently. So these simple maneuvers are huge for early detection. Finally, there's tertiary prevention. That's damage control, with physical therapy and bracing to keep a person as functional as possible.
All right, to wrap things up, let's do a quick rapid-fire review. These are the absolute key concepts you've got to walk away with. Ready?
First one, you've got a patient with a peripheral nerve lesion. Why is their reflex diminished or even gone? Think about that reflex arc, that simple circuit. Where's the break in the chain? Exactly. The lesion physically breaks the circuit. The signal just can't make the round trip from the muscle and back again. A weak or absent reflex is a classic textbook sign of a lower motor neuron or peripheral nerve problem. Okay, next question. This one seems a little weird at first. Why in the world would we use antidepressants to treat nerve pain? It's not about making the person happier about their pain, I promise. The key is that these specific drugs work on the body's own pain control system. Think of it like this. The brain has descending pathways that act like a volume knob for incoming pain signals. These medications basically help turn that volume knob down, dampening the constant, static-filled signals coming from that damaged nerve. And that brings us to our final thought for today. We've seen how complex nerve damage is, and we know that regeneration happens at a snail's pace. So this leaves us with a really important clinical question. Where should we, as clinicians and as patients, really put our energy? Is it into chasing that long, slow path of regeneration, or is it in the relentless proactive work of prevention? I'll let you think on that. Thanks for joining this explainer.